You're usually supposed to write those and dates on there?
Name also inside.
No. When was it opened? No date. So we need to write a date. I would write 8/5 on here because that's when they delivered it. Since we're not sure. So today, okay, this one is expired. So I wouldn't use that. Hopefully there's another one in the fridge. 7/19. And this one is expired as well. So these two are expired. Fishing is okay. So these two need to go. And then I'll just need to look in Google. Hi there.
Hi, who's my nurse?
What room are you in?
18.
I'm not your nurse. Your nurse is over there in the front.
Well, you can speak to
I
me
don't know.
in less of a rude tone of voice. That's quite rude the way you just addressed me.
Okay.
And secondly, I appreciate some cooperation. I shouldn't need to have to go track down my nurse.
What is this for?
That's the recipe.
No, but I mean, why is it in here if we're not using
Yeah,
it?
because they don't want to take it out yet. So emergency, you put a tape on it because you don't have to count it every day. Only time.
But there's an active order for it? Or is it a discontinued medication? Is there an active order?
Huh?
This medicine, does it have an order from the doctor?
Yeah.
It's still
For emergency.
I see.
That's for emergency.
All right. So we're all set. Thank you so much. You know what? I'm getting ready to walk that way. Maybe we can find a nurse.
Okay, and who are you?
I'm the pharmacist. I don't work here, but I'm getting ready to go over there.
Okay. Yeah, I'm in pain. I can't walk there.
Okay. You said you were in what room?
18.
Okay, I'll let him know. And what is your name?
I'm Carol Ducray.
Ducray. All right.
Thank
I'll
you.
let him know.
So there's the cart at the end of the hall. Somebody's standing there. I don't know what they're doing, but they're not bringing me my medicine. And it's after 6 p.m. and I'm in pain. I'm due for my muscle spasm medicine and my pain medicine. 2 pain medicines and a muscle spasm medicine are now overdue. I'm suffering and nobody's paying any attention to it. You can see how far away the front station is. It's a long distance.
Excuse me. Pardon me, thank you. Thank you. Okay.
So nobody's doing anything. Nobody's doing anything about the fact that my medicine's overdue. So the pharmacist who doesn't work here apparently just heard that somebody doesn't have a key or something.
I just arrived here. You don't have nurse right away.
I don't have a nurse?
Yeah, she called sick. I just arrived here. They called me.
Oh.
They called me late.
Oh.
Yeah, there's no nurse. A test. If you know test. She called sick.
Mm.
Oh my God, everybody's calling sick. And everybody's going for vacation at the same time.
That's really difficult because I know that there's hardly any nurses to begin with, so you must have a lot of patience. Sorry, I'm all out of breath.
There's some,
Oh my gosh.
they're getting rid of their insulin too.
Oh my gosh. Okay, so. Okay. Thank you.
You're out of breath.
Yeah. It's part of why I'm here, as I get out of breath very easily. Thank you. Thank you.
Okay, I'm so sorry about it.
I'm
Thank you for your patience.
thank you. Are they gonna?
I'm sorry.
What happens now? Do you call a temp agency, or what happens now to help, like?
Oh, the registry where they get pulled out nurses, even the registry, they're running out of nurses too.
Oh my gosh.
This is problem all over the place.
Oh my gosh.
All facilities. That's why.
Oh my.
I don't know. This is what they call when the. Have you heard about baby boomers?
Well, yeah, a lot of people my age group
Yeah.
are aging.
Baby boomers is like a little older than you, and they're coming. They're all getting sick at the same time. All facilities are crowded. All hospitals are crowded.
Oh my gosh.
So they're even offering high rate now for the nurses to invite more nurses.
Oh yes.
But takes time.
Yeah, of course, hiring, you gotta, yeah, I
they-
did hiring, it takes a while.
They raise ours, but nobody's coming. Oh my God. No, there. I got one already, Teresa.
Yeah.
The only one.
Oh, yeah, I noticed she was pretty new and she stayed.
I asked her to stay here.
Well, that's good,
She was my
yeah.
classmate,
Oh, how nice, that's nice.
Teresa.
Oh,
Or we call her Tess.
yeah,
Because there's a Teresa, the older Teresa.
yeah,
But
yeah.
you don't get her because I know you don't like her. You're not gonna like her.
Oh.
The older Teresa.
Oh, is that the one that's at the back station right now?
Yes, she's the older.
Yeah. Oh,
Okay,
gosh.
Super, I'll see you exactly 9 o'clock tonight.
Thank you very much.
Okay, you're welcome. Thank you for your patience.
Thank you. Well, people have definitely, quite a few people have been more kind and professional since I started posting videos to YouTube. Prior to that, I was mistreated by almost everyone in the facility. just word is given to people when they get hired that there are patients that are targeted to abuse. We don't like her, or I don't know. I don't know exactly what messages get told to people, but every time a new nurse comes in to give me medicine, you can tell from their attitude that they've been given some kind of instruction or warning or, I mean, nurses are supposed to, I think they call it report to the next shift, where they're supposed to educate the incoming nurse about the patient's medical needs, the medicines they take, their preferences, and so forth. And that's to ensure continuity of care, and that's a good thing. But at the same time, this facility tends to communicate prejudices and just notify that there are patients that are okay to just mistreat. And you can just tell when someone, has an interaction with you, whether or not they've got some kind of predetermination about how the interaction with you is going to go. And I'm aware, of course, that there could be various reasons why someone would have a guarded or a negative attitude walking in from the beginning. They could be having a bad day. It could have nothing to do with the patient. But it has happened far too often, and it's been, I've gotten kind of stared at rudely far too often and spoken to in a rude manner, in an unfriendly manner, in a challenging manner, like they've been told that I'm going to give them nonsense or be difficult or something, which is actually not the case. I'm normally just a kind person to everyone. That's my natural disposition. That's how I just am. That's how I like to be. I like to literally treat others the way I want to be treated. And if I didn't have a naturally sunny disposition, I wouldn't have been able to survive this place the way that I have, because all of the negativity and abuse that have been ongoing for nearly 3 years, it'll be 3 years on September 9th, it would break a lot of people down. But I'm able to compartmentalize and not just generalize and have a negative attitude. I'm able to enjoy my life as much as possible. I was told 6 years ago that I could die at any moment and I wasn't going to be alive in 6 months. And so, that was an adjustment. And you decide, or I decided to just make the best of it. And so I just spend each day looking. I always have. I've always looked for the good in every day and the good in every situation. That's one of the things that always made me popular with people, my friends and coworkers and colleagues, professional colleagues, and everybody generally appreciated that whenever there was a dark cloud, if there was a silver lining, I would be the one to find it. And again, it's just my natural disposition, and so I'm generally kind to people. But if somebody walks into my room and from the first moment they walk in, they're glaring at me and they're speaking to me in a manner that is disrespectful. I'm not a patsy. I'm not a pushover, and I'm not going to be bullied, and so I will stand up. I won't let people steamroll over me, and so I will stand up for myself under those circumstances. And so if people push at me, I do stand up for myself, and I do push back in that I'm not the aggressor, but I'm assertive. I don't like being aggressive, and I'm not aggressive, but I am definitely assertive, and I assert my rights. When people are aggressive to me, I assert my rights. And if someone's unpleasant to me, I will be unpleasant in return, because, it is situational also. Like, I assess, I do an assessment. It really depends on the person and the situation. If at first I'll try to figure out, are they just having a bad day? And it has nothing to do with this place or anything they've been told, or it has nothing to do with me. I'll try to make a positive difference in people's day and be pleasant, and try to get them to even open up and talk about what's bothering them. I'm kind of well known for that. I know my daughter, when she was going through her really difficult teenage rebellion phase, I didn't think she was really paying much attention to anything that I did or said at that time. But when she was 19, she said some things to me that just surprised me, that she had always noticed. She said, "You always look for the good in people, you always bring out the best in people. I've noticed that, every interaction that you have, you'll go to the grocery store and you ask people how they're doing. You really mean it. You really want to hear how they're doing. And if they're not having a great day, you tell them that you hope it gets better, and you're sorry that's happening, and you'll ask, kindly, not in a prying way, but if I can't remember, just people tend to, when they realize that a person is being kind to them, sometimes they'll talk a little bit about what's wrong, and they won't go into detail, but my daughter said, I noticed that, people will be really uptight and upset, and then by the time they're done talking with you, they'll be relieved and they'll be happy, and their mood will be completely changed and turned around, and you have this great effect on people. And it just really did my heart good that my daughter noticed that about me, because like I said, she just seems so critical of me and rebellious, which is just normal, in our society in America. That's the normal thing for teenagers to do. A lot of societies don't allow that, but ours does. Anyway, so we've just seen that the older Teresa, that lady, the nurse just now, she knows that I really don't like that older lady, because you saw the way she spoke to me on this video. She is always like that. She is, or worse. She's just, she has been extremely rude to me in the past, and for no apparent reason, but she's one of the people that it seemed clear to me people had told it was okay to abuse me. The order comes from the top at this facility. The owner that works on site gives her favorite people, blanket permission to do what they want, and there are a lot of people that worked here a long time, work together, and they're just in league with one another and supportive of one another, and it's just this groupthink mentality. And they really enjoy abusing people. They think it's funny. It's very entertaining and amusing for them. And I'm one of those people that is on the list of people it's okay to treat however they feel like. And so we see that in the various videos I've posted of people harassing and abusing me. It's just open here. But it's worrisome right now that, I appreciate that the nurse just now said she'll be here on time at 9, and I'm grateful that she was apologetic. I'm not sure if she would have been quite as pleasant and accommodating if I hadn't had my phone in my hand. And Gus, the maintenance person, had warned people. I heard him, and it's probably on the video. He said to Rico, watch out, she's got a camera. And I heard that, so maybe the camera picked it up. Although this camera does have some technology that tends to try to screen out background conversations. It's intended to be helpful. However, in reality, things don't get recorded that you want recorded if your goal is to show everything that is happening to you, which is the case with me. I want to pick up the people in the background that are ridiculing and laughing at me. I don't want that screened out. And anyway, so I think that's enough for now.